From 12 News, this is Newsmakers.
Welcome to Newsmakers. I'm Tim White alongside my colleague Ted Nesi. A stunning 1 in 4 Rhode Islanders in 2020 lack adequate food. The troubling finding, part of a new report by the Rhode Island Community Food Bank. Joining us in studio now to talk about food insecurity, especially during the pandemic, is Andrew Schiff, the CEO of the food bank. Andrew, it's good to have you back again. Welcome back to Newsmakers.
Good to see you again.
So I want to start with a chart that is high up in your annual report, and it shows the needle was moving in the right direction over the last few years. Then 2020 came, and people can see it on the screen right now. Clearly, the pandemic recession is driving how much need there is. But you've been doing this a long time, Andrew, and seen a lot. Did this number on the far right-hand side, 2020 for 2020, 25% food insecurity, did that surprise even you?
Absolutely. It's shocking. The report focuses on the financial hardship that Rhode Islanders are experiencing right now. But the idea that it's so bad that people are running out of food and can't afford to buy more at this level is just awful. And even though I've been doing this work a long time, it is the most upsetting finding for me in 20 years.
Are you meeting the need? Is the community food bank able to hand out enough food for the people that need it?
Fortunately, we're like the backup for a lot of other government assistance.
Like SNAP, food stamps, so on and so forth.
Exactly. And that has played a major role till now, so that, yes, we've been able to meet the need, even though it's been so high. Our worry is that as the government assistance begins to end, will we be able to fill that gap?
Well, for a lot of people, it already has ended, right? I mean, especially the $600 extra a week in unemployment benefits that ended in July. Did you see an uptick when that ended for a lot of people?
Almost immediately.
Really?
We saw more people lining up at food pantries, and that's often the case for us, that when there is a cut in government assistance, we see the effect right away.
Andrew, you, as we've alluded to, you've been doing this work for quite a while. In fact, you took over the food bank CEO job in May '07, just as the Great Recession was just beginning in Rhode Island. So you saw that crisis, and now you've seen this crisis. It sounds like this one's even worse, and that was pretty bad. How would you compare these two crises you've seen in your time as the head of the food bank?
The difference here now is just how sudden this has been. We were alarmed by, and everyone realized that we had an outbreak of COVID in March. In February, we had served through the food bank 50,000 people across the state. We thought that was too many. By April, we were serving 68,000 people. It wasn't like that in the Great Recession. It was bad, but it was much more gradual. And we had a chance to kind of work up to it. This was overnight. This was sudden. And of course, it was horrible for the people who suddenly found, businesses closed, schools closed. They were out of work. They were worried about not having any income, and people were panicked.
What is the trend now? We're many months into this. Obviously, that initial spike, we've all unfortunately gotten a little more used to this, and you've, I'm sure, adapted as best you can to the situation. I mean, have you seen a tapering? Is it ramping up again? What does it feel like right now, the situation?
So that panic that we saw in April began to calm a lot by June, as the government assistance programs began to kick in. And then as they've ended, we've seen the need ramp up again, combined with that we're going into winter. People are also struggling to pay their heating bills, and we are having a spike in COVID right now. Those two things together are driving more people to food pantries again.
I should have said this off the top of the show to our regular viewers of Newsmakers. You'll notice that we are spread far apart, which is a little bit unusual, but just for what you said, Andrew, because we're seeing another spike. And when we saw a spike at the beginning of the pandemic, there were images of people just stockpiling food and a bunch of items at the supermarket. people might not realize, but a big part of the supplies you get are direct donations from supermarkets. Did people's behavior then, and we're seeing it now, cut in to those donations because supermarkets themselves were running out of supplies?
Absolutely, and every time I say this and explain it to folks, I always want to say the supermarkets are big supporters of the food bank and are very generous. When they don't have surplus food to donate, they just can't donate. And it doesn't matter how generous they want to be. They just don't have the food. They're trying to keep their shelves stocked, as you point out. And so there isn't surplus food to donate to us. We've seen a big drop off, more than half of what we would expect. And we're making up for that loss by purchasing food. We purchase in large volume truckloads of food from wholesale at very low cost. But of course, there's a cost versus donated food, which we're getting for free.
And are you seeing, are people being more generous financially to the community food bank?
Absolutely. We have seen an outpouring of generosity from the community. I'm extremely grateful for that. In the beginning, in March, when we realized that the donation of food supply was going to not be happening, I immediately began telling my staff to bring in truckloads of food because we saw what was happening and we're very worried about having enough food in the food bank. And my hope was, you build it and they will come. My hope was that the donations would follow, and they have.
So I want to ask you, there might be someone watching today, maybe who, they felt they were in a pretty good financial position at the beginning of 2020, and for whatever reason, maybe their employer shut down, maybe their line of work's been out, and they're suddenly in a very different financial situation. But they might not. They might say to themselves, am I someone who can access the food bank? Did I have too much income at one point? Are they going to ask me something? Am I not? Would that be wrong? Is it for people poorer than I am? Who is the food bank for, and how does someone who unfortunately maybe hasn't previously had to seek assistance from the food bank, how do they go about doing that?
In normal times, the way I would answer it is just to say we're for households who have income below poverty. But in an emergency, when folks have suddenly had their income cut off, as you're saying, maybe last year they were doing fine. Now they don't have income. The food bank is there when you're running out of money for food. We always are encouraging people to make sure they're taking advantage of government benefits that they're eligible for first. Get those benefits, make sure you're getting unemployment, make sure that you're getting SNAP benefits. But sometimes even that help can't feed the family, and then you've got to come and turn to us for help. And it's easy to do. If anybody's watching who needs help, call 211. That's the United Way helpline. A real person answers the phone, and they'll direct you to one of our member agencies.
And are you seeing people who maybe say to you, I didn't expect I'd be someone who needed help from the food bank due to the crisis this year?
Absolutely. It's so heartbreaking. We have a job training program at the food bank called Community Kitchen. We prepare people for jobs in restaurants. And our alumni who were so successful, they went through our training program, they got jobs in that industry, they're out of work. And for them, because this is what they were experiencing back in 2008, 2009, it's a nightmare.
Andrew, when people think of the food bank, they often think of canned and boxed non-perishable items. I was reading your annual report, and I saw something really interesting in there, a program by the USDA called Farmers Feeding Families, where farms get these special boxes that they can ship perishable food, think meats and vegetables, to food banks across the country. Wondering if the Rhode Island Community Food Bank took part in that, and did Rhode Island farmers get involved?
Yes. So this was an emergency program that was set up back in March, and we got going with it in April. Back then, it was a partnership between the food bank and Farm Fresh Rhode Island.
Yep.
And all of the food that was coming was from Rhode Island farmers. It was really fantastic, and it allowed us to provide fresh, locally grown produce to people in need. 1,000 boxes a week throughout that period. The federal government switched up the program in August. And Farm Fresh, unfortunately, and Rhode Island farmers were no longer able to participate. And we still got boxes, but it came from a farm in Delaware. And we wish it had stayed with that local program. And we're going to figure out a way to work with Farm Fresh in the future because we saw how much good it did.
No offense to Delaware farmers, of course, they're fantastic, but
they've got a president now.
That's true. We have 1 minute left here, Andrew. Ted asked you the question about people who need assistance. What should they do? What about people who are watching that want to help? What do they do? What do you need?
If you go to our website, rifoodbank.org, we make it easy for folks to donate, and I appreciate every donation, every dollar makes a difference. But also it's an opportunity to learn more about what we're doing, the challenges that we're facing, and the challenges faced by all the community partners that we work with. You'll see the list on our website of 158 member agencies across the state that all make up the network of food assistance. Check it out.
Andrew Schiff, CEO of the Rhode Island Community Food Bank, thanks for coming in and happy Thanksgiving to you. When we come back, Dean of Brown University School of Public Health, Dr. Ashish Jha, speaks with our colleague Steph Machado. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White. For this week's episode of Steph Machado's The Pulse of Providence, Steph interviewed the Dean of Brown University School of Public Health, Dr. Ashish Jha. While there's a sense of optimism as vaccine trials are showing promise, we all know that COVID cases and hospitalizations are on the rise. Steph talks to Dr. Jha, a leading expert in the field of public health policy, about the upcoming governor's pause that starts on November 30th, and if schools should remain open.
After Thanksgiving here in Rhode Island, we are going into a 2-week pause. The governor announced this last week. It's an effort to tamp down on the increase in coronavirus cases that we've seen here in Rhode Island. But I want to know, in your experience so far, looking at data in the pandemic, is 2 weeks enough to get enough information on whether the pause worked? Can we look at data at the end of 2 weeks and say, okay, we're ready to reopen some of these things? Or do you need more time to see if it worked, if cases are down, if it decreases the hospital capacity?
Yeah, so I think 2 weeks is sort of that bare minimum. That's basically what you need. We should start seeing by the end of that 2 week period, let's say a week or 10 days in, you'll start seeing the effect of that policy. So I think if the governor had done it for much less than 2 weeks, it probably wouldn't have been useful, but it will give us the data we need. And at that point, the governor, who I think has been really very data driven and has tried to make policies based on evidence, will be able to decide what she wants to do next. So I think it's a pretty reasonable timeline to start with.
Speaking of data-driven policies, one of the items in the 2 week pause is that gyms and fitness studios are going to close. We've seen quite an outcry from the owners of those facilities who say, we're an indoor space. Sure, we know indoor spaces can cause the virus to spread, but a lot of indoor spaces are being kept open, including indoor dining. Is there evidence that indoor dining with masks off is safer than a gym or a fitness studio?
Yeah, the evidence on this is a little bit mixed. We do know that gyms can be a source of spread. And especially because in gyms, people are obviously working out, they're breathing hard. And the harder you breathe, the more virus you exhale. So that can be a problem. And certainly if there's gets to be any gym classes are potentially really dangerous. So there is evidence around this. Dining is one where there is a bit more of a mixed set of data. The key issue on dining is how crowded is it? Obviously full indoor dining right now would be a disaster. But the question is, if you pull it way back, have only 25 or 33% of capacity, can you make it safer? And I think the answer is you can. You still need to work on making some things like ventilation. And if you want to be purely focused on keeping the virus to as low as possible, you might close indoor dining. I think the governor's trying to thread a needle here where she's pulled back on indoor dining, but has closed other things that we also know are high risk.
Do you think a pause on indoor dining is a good idea right now, just based on the numbers you're seeing here in Rhode Island?
Well, I think, look, there's no single policy. I look at what the governor has done here versus like what Governor Whitmer has done of Michigan, and they're very similar, but a little different. I think we'll learn from looking at both of them to see which ones work better. Overall, it's the package of activities that I think is really important. Any single thing you can nitpick and say you can do it this way or that. I do think pulling back on indoor dining, as the governor did, was a really important step.
I want to ask you about the schools, because the governor has cited you in her briefings about why it's so important to keep schools open. It seems that will be perhaps the very last thing she would close of all the things that she might close potentially in the coming weeks if the virus numbers get worse. We saw New York City schools last week close because the city hit a positivity rate of 3%. Right now, the city of Providence, the second week of November, had a positivity rate of 7%, which is the most recent municipal data that's available. Is there a threshold or a number at which you would say, all right, the community spread is just too high, let's do a pause of in-person schooling until we can get the community spread under control?
Well, this is an area where my views have changed because the evidence and data have changed. So over the summer, I would have said yes, above, I don't know if I would have used a threshold of percent positive, but I would use cases per 100,000 and said, at some level, you just can't do it. That's because we didn't have a lot of data over the summer because we hadn't been running schools, right, during the pandemic. What has happened since the summer is a lot of schools have opened, including in places with very high levels of community transmission. And to my surprise, we have not seen the virus spread much in schools. We have not seen schools become a source of spread in the community. And we have not seen, even with high levels of community transmission, kids or teachers getting sick in schools. Now, obviously, kids and teachers are not immune. They can get infected outside of the school. But it really does appear like the school may be one of the safest places, both for kids and adults. And you may say, well, how could that be? It's an indoor space. Why would schools be safe? What appears to be right now going on is schools are pretty well regulated, right? Like kids are wearing masks, everybody's wearing masks. Now, I'm not saying open schools and do nothing. You got to mitigate, you've got to have mask wearing, you've got to have some amount of distancing, you've got to be able to open windows or have reasonable ventilation. But it turns out those are actually things that people can do in schools that people are not doing at home in the same way. And so I have not seen any clear threshold beyond which I would close schools. I think New York City closing their schools at 3% just doesn't make any public health sense. And what I have said is, we don't close hospitals. We ask nurses and doctors and other essential workers to travel to get to the hospital. We should try to think of schools as an essential service and do everything we can to protect the workers in schools, the teachers, the staff, and the kids. I think it's doable. If you're going to close schools, my goodness, it should be the absolute last thing to close, and it should be the absolute first thing to open. But I think especially K through 8, we can get away without opening schools, without putting people in danger.
We hear a lot about children not being affected as harshly by the virus in terms of symptoms. Doesn't that mean, though, that they could be asymptomatic carriers? It could be spreading in schools. We don't know. They're bringing it into the community. They're spreading it to their teachers, their parents at home.
Yeah, that's a fair question. How do we know it's not spreading in schools, right? And the reason I feel reasonably confident at this point to say that I don't think it's spreading, and again, remember, I was the super cautious guy who over the summer was like, if there's much community transmission, you can't do this, is places opened. There's been testing happening in many schools across the country. Even New York City was doing testing, random sample testing of teachers and kids, and finding very little virus, very little infection within the kids and teachers in schools. So it's not like we have perfect data, but we have reasonably good data, more and more data. Something that Professor Emily Oster, who's also at Brown, she's been collecting data from school districts around the country and looking at their infection numbers. Again, tiny compared to community level spread. So I feel pretty confident at this moment that we have pretty good evidence that this is not where a lot of transmission is happening.
Rhode Island is going to start a pilot program to do surveillance testing of asymptomatic students and teachers in school. I imagine you will be very much looking forward to seeing that data as well.
Absolutely. In fact, I was thrilled to hear both from Dr. Alexander Scott, our health director, and Governor Raimondo, that this is what they're planning. Rhode Island has been doing a lot on trying to improve testing availability overall, and now with more tests coming online in Rhode Island, I think schools are a great place to use those tests. It'll actually offer us a lot of assurance. And if it turns out that we see large amounts of spread happening in schools, we can always close things down, but I'd be very, very surprised. My guess is we're going to see that schools are reasonably safe, especially K through 8. But let's look at that data from Rhode Island when we have it, and then we can make smarter decisions.
You've been one of the loudest voices about testing, since March, talking about how we needed to ramp up the testing capacity of the country. Rhode Island has certainly ramped up its testing capacity. But, we heard from hospital leaders just last week that they don't have enough tests to even provide it to their staff members that could be getting exposed to COVID positive patients. So what is your assessment of where Rhode Island is at in terms of its testing capacity and where we should go from here?
Yeah, there's a broader problem here, right? Which is that the federal government, which should really be helping out, has really been AWOL. And that's been the big issue. That Rhode Island has done a very good job, but states can't do this by themselves. They need resources. Testing supply chains are national and international supply chains. And what the federal government has done is essentially asked all the states to compete with each other for the same set of supplies instead of increasing the availability of these things. It's really quite frustrating. This is where we are. Again, I think Rhode Island's done a good job. Do I wish Rhode Island had more tests? Absolutely. I think Dr. Alexander Scott would say she wishes that we had more tests, our health director, right? They are coming. There's going to be more available in the weeks to come. My hope is by the end of the year, there are a lot more tests. And certainly once we get into 2021, January, February, I expect much more testing available. I wish we had it today.
Is there a goal you think in terms of tests per day we should be doing in Rhode Island?
Well, that's a good question. There are different targets. It's sort of the way I look at it is depends on what we want to be able to achieve. What I would love to get to a point of is anybody, symptomatic or asymptomatic, can walk in and get a test. I'd love to be able to do ongoing testing of all the nursing homes, the schools, the healthcare workers. That will end up requiring tens of thousands of tests a day. Again, not realistic that we're going to get there right away, but I do think that's possible, and it'll probably take us a few months before we can get to, many tens of thousands of tests a day. But that's what we should be shooting for. It will make everything much, much safer.
And as we ramp up to that level of testing, we're also awaiting this vaccine. More news this morning about another vaccine candidate being effective. We know that the vaccine is going to be dispersed to certain populations first, and it could take months, maybe till next spring, next summer, before maybe a healthy young person like myself gets the vaccine. But at what point do you think enough people will have gotten the vaccine that we will have some level of immunity in the community that it'll be safe to resume a lot of activities? Do you have an estimate on that?
Yeah, it's a very good question. The way I see it is it all depends on how effectively and how quickly we can get these vaccines out. Some of the vaccines are really very, very effective, Moderna as well as Pfizer. The AstraZeneca vaccine data out today, we're still learning about it and what exactly its effectiveness is going to be. But we're going to need to start getting these things out in December. And I expect that by the end of January, if you believe the target set by Operation Warp Speed, 50 million Americans will have gotten vaccinated. That's about 17% of the population. I expect that in Rhode Island, by that time, we'll have probably close to 20% of the population may have already been infected. And you combine them, obviously some overlap, 35% of people may be immune by then. Even by the end of January into early February, we will start seeing the spread of the virus slow way down. And once we get into March or April, first of all, I expect widespread availability of vaccines by April. So almost anybody should be able to get it by April, maybe May at the latest. But even before then, February, March, the virus amount of spread in the community really should start slowing way down.
Okay, so that's optimistic for folks to hang in there. Maybe they can't get the vaccine by February, but the community spread should be down by then.
Yeah, and this is the thing, right? We're all in this together. And so if we can get some chunk of people vaccinated, it'll help everybody because their immunity helps protect everyone else too.
That was just a portion of Steph Machado's interview with Dr. Ashish Jha. If you want to watch the entire Pulse of Providence episode, go to WPRI.com. There you can see prior episodes, including the pilot with Providence Mayor Jorge Elorza. And I'm a broken record on this. While you are there, make sure you bookmark the Track Cases page. It was designed by our own Target 12 investigator, Eli Sherman. It puts a lot of a lot of data into context, and I think with so much information coming at you right now, it will be invaluable. Look, a lot of you are watching this on the Sunday after Thanksgiving, so I want to wish all of you, either way, a happy and safe holiday. For Ted Nesi, I'm Tim White, and we'll see you next week on Newsmakers.